In this film, you will learn step by step how to empty your bladder with SpeediCath Compact Eve. It is relatively simple, but will require some practice. Start by washing your hands thoroughly with water and soap. Remember also to wash your thumbs. Alcohol hand gel can be used if you don't have access to washing facilities. Make sure you have all the equipment you will need before you start. You will need a catheter of the appropriate size, intimate wipes or soap with a neutral pH value and water, and perhaps a mirror which can be fastened onto your thigh. If you need a bag to collect the urine in, have this ready also. Pull your clothes down so you can move freely when doing the catheterization and sit down on the toilet. If you are able to urinate, always try before you use a catheter. To prevent pushing bacteria into the urethra and bladder when you use the catheter, you must first clean the area around the urethra properly. Spread the labia apart and wash the opening to the urethra. Wash from front to back in order not to transfer any bacteria and cause an infection. Use each wipe only once. Hold the catheter upright so the handle points upwards. Open the catheter by turning the handle in either direction to break the packaging. Gently pull the handle upwards approximately 2 centimeters until you feel a resistance. In this position, a urine bag can be connected to the end of the handle if required. Insert the urine bag connector into the opening at the top of the handle and make sure it is firmly connected. To fully open the catheter, continue to pull the handle until the sterile catheter is revealed. Make sure that you do not touch the lubricated part with your skin or clothes to avoid contaminating the catheter and potentially cause infection. To make the insertion of the catheter as easy as possible, it is important that you relax. Slowly and gently insert the catheter into your urethra. Continue until the catheter reaches your bladder and the urine starts to flow. Then continue for a few more centimeters. When the flow stops, move a little and straighten yourself up to make sure that the bladder is completely empty. Slowly withdraw the catheter to ensure that you drain any remaining urine at the base of your bladder. The catheter can be reclosed by reinserting the catheter into the container. If a urine bag is connected, it must be removed before the product can be correctly closed. You can dispose of your catheter in your household rubbish. Do not flush it down the toilet. Wash your hands, and you have completed the process. The catheterization procedure must always be carried out under guidance from a healthcare professional. The instructions provided in this film are only intended as follow-up to the advice you have already been given.